Hi, everyone. Thank you for joining us. We will be beginning shortly.
Are there people?
Yes.
Okay, great. I have like information about people. Do I?
Yes.
Oh, just that.
Yeah, just that.
Right, okay, good, that's fine. Should I think what I'm gonna do is I'm gonna introduce everyone at
Okay.
the beginning, and then it's like. Yes. Sorry, it's gonna be. Oh, there's Luce. Allison. Okay, I'm gonna give it one more minute, one more minute.
We're gonna have to be like across the other side of the building from me, so on the. It's like west and. Oh, thank you.
I can't believe your wife is finished. I feel like you just moved to Maine like a year ago. No, huh? It was like 4 years ago. How long ago did you move?
Yeah.
3.5.
Okay, okay. So you survived a residency and, yeah, yeah. I've lived through that. They, but we didn't have any kids during the residency, so.
Good to be done.
Yeah.
So you are an MD too?
I'm not my wife. I finished residency.
Here?
She did it at Maine Life up in Portland.
Okay, I think we'll get started. Great to see you all. I'm assuming that this is on. Folks who are on Zoom, can you hear me? Can somebody give a head?
Yes.
Yes. Thank you, Luz. Thank you, Allison. Hi, Dina. So I'm welcoming everybody, the in-person people and the people on Zoom, to our October Research in Progress. And we are the Institute for Early Childhood Wellbeing, and the Research in Progress is something we've been doing for multiple years now, at least 3. And we have been it's been a delightful process of hearing from people across the university about the work they're doing. And I will say that numerous matches have come out of these sessions where people starting to do, convergent research, submitting abstracts. These sessions together have a long legacy, and people have met in convenings of early childhood folks for how many years, Peter? Going back, when did you meet Amanda? Yeah, so we build on our history, and now finally the university is recognizing that convergent research across the campuses and across disciplines is kind of where it's at. So we were ahead of the curve, but we're happy that they're recognizing it, and particularly, of course, about young children. So that's great. So I'm Ruth Paris. I am the Associate Director for Research of the Institute. Dina Castro just came in. She is our director. What I'm going to do now is just tell you everybody who's going to be here, and then people will come up. And so everybody has about 15 minutes to give their presentations, and we have some time, depending on how much you use, for a little bit of question and answer right after your presentations. And then at the end, we also have time for some, how does this all, does it? Are there interesting things about how pieces fit together? So the first presentation is going to be by Peter Rockers, who is an associate professor of global health at BU School of Public Health. And the title of his presentation is The Ultra Poor Graduation Approach and Child Development, which I was really interested in hearing about. The second presenters are Dolores Acevedo Garcia and Pam Joshi, and they are from my school, the School of Social Work. And Dolores Acevedo Garcia is a professor of human behavior, big department, human behavior research and policy, and the director of Institute for Equity and Child Opportunity and Healthy Development. And Pam Joshi is a research professor of human behavior research policy at the School of Social Work. So second presenters, and the third presenter is Stephanie Ettinger de Cuba. And Stephanie is a research associate professor of Health Law Policy and Management at the School of Public Health. And are you also have an appointment at the school social work? Did I see that somewhere? Oh, okay, Madison, because then I saw this. Oh, thank you so much. Look at this. Okay. And Stephanie's going to talk to us about associations between childcare constraints and health and material hardships among families with young children, opportunities to improve equitable access. And I'm sorry, I forgot to do the second title, which people will do, including immigrant families and children in the U.S. tax and transfer system, advancing evidence and state policy action. So sounds like amazing presentations. So I'm going to step off and invite Peter to come. Don't need our Peter slides up. Yeah.
Okay, great. Great to be here with everyone. So I have 15 minutes. I'm gonna launch into this. This is a project I've been working on for several years, and it's piggybacking off of a project that actually started as far back as 2019. It's actually at a critical point right now. We have teams in the field collecting some data that will kind of wrap up this, what I'll talk about is a second wave of data collection. I'd anticipate there will be future waves of data collection following this cohort of children over time. So it's nice to be able to present it to you all and look forward to your thoughts on it. So let me start just with a really quick overview of what the ultra poor graduation approach is. I could spend a lot of time talking about it, but it's not, for the sake of time, I'm just going to give kind of a high level overview. So this is really a poverty alleviation program, a multifaceted, multi-pronged intervention. Basically, it's a one-time asset transfer targeting, I should say, the population that's targeted. These are what they call, this term ultra poor generally refers to folks that are caught in a poverty trap. And a lot of the kind of evidence around that feeds into the design of this approach is around how poverty traps kind of function and exist. And mostly we're talking about in low-income countries. So most of this is outside the United States. And a lot of this work has been innovated more in the economics profession. So a lot of kind of the lead researchers who have developed and evaluated this broader approach called graduation are economists. So it's a one-time asset transfer. It's a series of monthly cash transfers that are meant to be sort of support consumption as households take the asset transfer and turn it into an income generating activity and hopefully transition out of poverty into a more stable, higher welfare kind of trajectory. And I'll talk briefly about the evidence around sort of what that looks like at the household level, whereas the work that I'm focused on is what that means for the children who reside in those households. The program itself generally runs for 18 months to 24 months. So this is not a ongoing type of program like traditional cash transfers that oftentimes run for perhaps years. This is meant to be a big push that is very concentrated in terms of the asset transfer, the consumption support, some life skills training, access to financial services, all in a relatively concentrated period of time with the hope that it can really kind of shift the trajectory of the household out of this poverty trap. It's been pioneered years ago by BRAC, and at this point has been rolled out in more than 50 countries and with more than 3 million beneficiaries. I will say that there's a lot of interest right now in what it would take to scale it up to more. I think there's been a lot of work over the last 10 or 15 years establishing the evidentiary basis that this type of program actually can have quite meaningful impacts on households, on consumption, on income, on various measures of welfare, kind of at the household level. And there's a lot of work to figure out how to optimize sort of the design of the program, bring the cost down, maintain effectiveness, and then scale it up. There's a bunch of different, I would say, funders that are kind of interested in this, governments. India, actually, several state governments in India are starting to incorporate the approach into their sort of public welfare system. So there's a lot of, I would say, ongoing work, and where my interest is more focused on, what does it mean for children? Real quickly, there's a kind of a big article that was published in Science in 2015 at this point that tested this model across 6 different countries, a sample of more than 10,000 households, and found very consistent evidence of quite meaningful positive impacts on things like consumption, food security, income, right, mental health, and various dimensions of sort of adult household level welfare. So I think the evidence base around what it means for the outcomes that it really targets, more at that household level poverty, the evidence is very robust. So the question is, what does this mean for the next generation or future generations, right? The graduation program really aims to improve the livelihoods and the income generating abilities of the adults in a household. And I think this group probably understands that poverty is transmitted intergenerationally, and really, if the ultimate long-term goal of a program like graduation is to not just move a household out of poverty, but to keep them out of poverty, and to make sure that future generations do not fall back into poverty. So the question then becomes, what does this type of program mean for the human capital of the next generation and subsequent generations? So very quickly, poverty has an impact on child development through many different biological and sociological and psychological pathways. I'm not going to go into them all right now, but I think just to say that the kind of theory of change of graduation, of shifting households out of poverty traps and into a new trajectory, I think there's plenty of sort of mechanistic science that would suggest that this should have a positive impact on children. But there's still important questions. I mean, there's a whole science around how poverty becomes biologically embedded, changes to DNA, changes to all sorts of biological systems that it might be some of the damage might not be possible to unwind in the short term, maybe in the medium term. I think there's lots of open questions around what it would mean to shift a household out of poverty, and what that would mean even at the level of sort of the biological embedding of poverty in children, and what it might mean for children in the short term and long term. So I think there's, it's not obvious just because the program has positive impacts on households that will necessarily translate to immediate positive impacts on children. And in terms of the existing evidence on what UPG has, the impact that it has on young children, there's really a dearth of evidence. There have been 0 studies that have been designed specifically to answer the question of what's the impact of the model on children. There have been several opportunistic studies that have kind of piggybacked off of evaluations of the program itself on household level outcomes, and they have found some short-term small positive effects on weight, no effect on height or stunting. Key methodological issues, these studies have not been powered to look at impacts on children. Probably more importantly, all of them have been within a few years of the introduction of the program. There's been no studies really that have followed children out beyond a few years. And I'll talk in a second why there's good reason to believe that any benefits that do accrue to children will probably take some time to emerge and to become measurable. So looking in the first few years is perhaps not quite the right approach. No previous studies looking at sort of skill-based outcomes. We're really just looking at anthropometric kind of nutrition types of outcomes. There's good reason to believe that the pathways through which the program might benefit children might not show up in just nutrition types of outcomes. And as I said, no previous studies with repeated follow-up. So just real quickly, there's a nice study that's shown, I'll just draw attention to, households that actually do benefit from the program. What you actually see is in the first few years of the introduction of the program, those households that will eventually benefit the most actually reduce consumption in the short term. And the explanation that economists would give, and that seems to fit the data, is that there's an initial period of savings. an initial period of investment or shifting investment towards the types of activities that will eventually get the household out of poverty onto a better sort of trajectory around livelihoods. And so reduce consumption in the short term, I think there's a good reason to believe that that might be optimal decision making in terms of a long-term goal of getting out of poverty. But if you're really only looking at impacts on children in the first few years, you might be looking in that period where there might actually be some shift in investment away from children to other types of investment. So becomes quite important to think about tracking children who grew up in these households over a longer time period. Okay, so in terms of where I come in 2021, so a study was done in Uganda to basically set up to look at the impact of graduation on all of these household level outcomes. Very similar to the science paper that I mentioned, but this study was set up to test a few different variations on the model, minor variations. So they've developed a whole cohort, a large number of households that were exposed to the program for 2 years, starting in 2019 to 2021. And then what I did is I did a follow-up in 2022. I went to a sample of the households that were in the study. So some exposed, some in the control group. So there's a randomized control trial. And I went and visited households that had young children who were born, most of whom were born just after the introduction of the program. So I focused on children in that 0 to 3 age range. Some of them would have been exposed in utero, some of them only exposed after birth. So we had some variation in that exposure type, but we had 1,500 children growing up across the intervention and control group. And the main focus of that first wave was to test the impact, basically exploit the RCT design of the main graduation trial and look at the impact of the model on children's outcomes. I should say the PI team for the main study is here. They're also collaborators on this work. So in terms of the actual household level outcomes for this Uganda trial, they found very consistent with a lot of other studies, big impacts on income, on consumption, on food security. So all of those household level outcomes that indicate sort of positive effects in terms of household level welfare, consistent with the other evidence. So what I did is I came in and administered the Baileys to this 1,500 kids, just to get a sense of if we're seeing any benefits with respect to these kinds of skill-based child development outcomes. I can, if anyone has questions, I can go into more what the Baileys is, but these are direct assessments of children in that kind of 6 months to 3-year-old age range, getting a measure of skill across 4 different main domains: cognitive skill, language skill, motor skill, and social emotional skills. And we went through a whole adaptation process. I've used the Baileys in a few different settings, and it's worked well. It takes time to administer. It can be expensive, but it gives quite robust evidence results. So the main finding from this first wave, no effect whatsoever. So pretty, I would say, pretty narrow confidence intervals, pretty precise nulls, no effect across any of the 4 domains of this program with relatively straightforward analysis methods, just straightforward models with some basic controls.
I'm sorry, just the clarification. After how many years of the intervention?
So the intervention was administered from 2019 to 2021, and then we come in 2022, and but we assessed children who were as kind of become exposed to the program. Some of them in utero, some of them are born by the time the program gets introduced, but they're all basically exposed from birth. Yeah, and some before.
The assessment happened when the children were 3, 4.
Yeah, the children were up till age 3. So some of them are not yet 3. Yeah. Okay. So what's happening right now is a second wave. So just to go back to what I mentioned, I think in terms of, this evidence that households are engaging seemingly in this behavior of in the early stages, getting this asset transfer, getting the consumption support, starting to save and even reduce consumption in the short term in order to, as an investment essentially on their longer term well-being and longer term livelihood outcomes. And so then I think that's where a good motivation would come to say, let's revisit. Now it's 6 years out from the initial introduction of the program. Households have seemingly, even the ones who are going to benefit most from the program, at this point, they should have all sort of shifted into sort of higher levels consumption as compared to the control group. And I should say the main PIs of the main intervention study did a follow-up last year and found similarly that the household level effects are stable and in some instances going up. So this revisit is to now see, okay, in the longer run, what are we seeing in terms of impacts on children? So the team is in the field right now. We're assessing a broader age range of children. So we're assessing children from ages 1 to 8, 6 years out from the introduction of the program, and we're going to look at a few different outcomes that are kind of depend on the age range. For all 1 to 8-year-olds, we're doing the anthropometric indicators of nutritional status. For 1 to 3-year-olds, we're instead of doing the Baileys for kind of limited resource reasons, we're using the CREDI, which is a caregiver report rather than doing the direct assessments of the Baileys. But that'll give a measure of kind of in terms of developmental milestones where these children are in that 1 to 3 age range. And then for children 4 and above, we're using a bunch of different instruments to measure a few different aspects of executive function and school readiness. So we're using the 4-digit span, the head, toes, knees, shoulders task. We're doing the Ravens for fluid intelligence, and we're doing this IDELA for school readiness, which is a well-established kind of validated tool for use in low resource settings. Okay, and I don't have any results. There'll be the field work should, I think, actually be done by next week. And then we'll start to kind of analyze it and get a sense of what we're seeing. I do think the plan is to do more waves in the future to continue to follow these children and consistent with kind of the theory of change around how the UPG model works. Expect to see potentially the household outcomes continue to improve, and this accumulation hopefully of benefits to children that become more easily observable over time. Okay, I'll stop there.
One more question, or the clarifying question is, from what you just mentioned, I am assuming that there are other measures related to the program that are being gathered.
Correct.
Right?
Yeah.
Factors, so economic,
Yep.
looking at the economics, other factors.
Yeah. So there's
So the connection between the children outcomes and
right.
the other variables.
Yeah, so there's actually multiple waves of reports already published with those main outcomes. So this was funded, the main study was funded with USAID money and through a few different organizations that have already kind of published the main results for those household level outcomes. And as I said, they just finished a second wave last year. So we have up till last year, we have good data on kind of what the impact looks like on those types of outcomes. Yeah. Correct. So consumption, it would be, what is the household spending money on across multiple different domains, including nutrition, non-nutrition, different types of kind of expenditure, all sorts of things, household assets, whether they've purchased land, kind of what their income is to the extent that they're working in in an area that is easy to measure income. So yeah, the economists have kind of handled all of that measurement, and those results are available already. Yeah. Yep.
First of all, really, really interesting.
Yeah.
And appreciate. So 2 quick questions. One is who's funding this part of the child focus work? So it's a quick question. And the other is, given the theory of change and given what we presented earlier on, and you've got now a breakdown of 4 or 5 measures on children, what's your hypothesis about what would change? And I mean, I realize it's probably a longer answer to that about which will change given what, but any of your thoughts about that or?
Yeah, so it's funded, this work is funded through the Gates Foundation essentially. Yeah, so, and the Gates Foundation is one foundation that's quite interested in, you know, whether this is a scalable intervention that should be, you know, that they might make a larger investment in at some point. So they're kind of doing due diligence around that. And they were particularly interested in the question of what it means for future generations. So this is not a large grant, but I think there's a whole set of additional questions that this study cannot answer. I mean, this is really, you know, we had enough money to basically go get these measures at an appropriate level of statistical power, which means going to a lot of households. But we're not able to answer, I would say, enough of kind of the mechanistic or the you know, to really flesh out the pathways to the extent I would like to. So I think that's more a future, you know, a future endeavor. So what do I expect to see? I mean, I think, you know, if in fact, you know, you're seeing levels of consumption increase that are quite large and growing over time. And, you know, I think the theory would be that on the one hand, that should lead to better nutrition. I think there already is evidence that it leads to kind of a reduced sort of biological stress in the environment, better mental health amongst caregivers, which could improve, you know, parent-child interactions and all sorts of sort of responsive caregiving types of behaviors. I would say that there is evidence, though, that, you know, part of this shift to you know, does lead to mothers putting a greater focus on labor market or working, and that there is a shift in time use potentially away from parenting. And so that there are questions around whether this needs to be coupled with kind of investments in childcare ecosystems to you know, if it's really meant to kind of improve labor market participation, what does that mean for childcare? So that's still an open question and beyond the scope, obviously, of my study. But yeah, I think, I mean, I think that is real potential from a few different pathways, but I do think that, and as I was, I mean, I think that poverty, the effects of poverty on children accrue over generations and you know, it's not entirely clear to me that you can just you can flip that switch back through like over a few years, just kind of improving the material environment in which children are reared doesn't necessarily undo all of the accumulation of disadvantage that has been built up over time. And so, I mean, I think there is actually a real opportunity within the context of this study to learn a little bit more about you know, more about the relationship between poverty and child development, given this kind of shock of getting households out of poverty is somewhat unique. I mean, even cash transfer programs, you know, the amount of consumption increase that you see in these types of programs is much larger than what you see if you just give cash transfers at the level at which most cash transfer programs currently sort of operate. So I think this kind of shock to potential, like improving the material environment in which children are raised with sort of exogenous experimental variation gives a real sort of opportunity for this science of looking at poverty and child development as well, which I think there's still a lot of unanswered questions. So I don't have a strong prior to say that it's definitely going to show this or that. So we'll see.
Thank
Yeah.
you.
I was curious if you could say more about the initial dip in consumption
Yeah.
or dip, and then what are the future things people are spending on? Do you have a sense of that? Like, what's that shift at the beginning?
So the drop, yeah, I mean, so that's, I can refer you to the paper that, I mean, yeah, this is not my work.
What it was that they were shifting to at the beginning there?
So the idea here is that they're in the first few years. So this is a program that was introduced around 2009, and it's a little. I mean, basically, what you're seeing here is the households that will eventually escape poverty, get out of the poverty trap in the first few years. Actually, compared to groups that, you know, are control group, their consumption actually goes down. I mean, the exact opposite of what you'd expect. You kind of injected all these additional resources into the household. And what you find is that in terms of like their expenditures on a day-to-day or monthly basis on food and other things has actually dipped quite a bit. So I think the argument here is that they see an opportunity to make kind of a big investment in some income generating activity. Yeah, so whether it's land or, I mean, this paper does go more into what exactly, where they're likely shifting those resources to. And then you see over time, you know, maybe the sort of more, you know, the resources that investment starts to generate start to dominate a few years out, and now consumption starts to really sort of ramp up. And as that consumption is starting, you do see them, you know, about, I think maybe half of that is goes into more nutritional consumption. So a lot of it is food. But then, you know, they start spending on all sorts of other things. But that paper goes into a lot more detail on that.
I also had a question about that. So is that related to the program itself? Is there some conditionality about the asset transfer that requires that people invest in something else in the first year?
So there's sorry, I don't know if I messed up. I was trying to see if someone had a comment online. Or maybe you could just tell me if there's any comments. There's no conditionality in terms of like in a cash transfer program. They don't necessarily have to. I mean, there is a whole eligibility process where I should say that this targets women. So the program is targeted at women, and the women are meant to be in an age range where they can turn the investment into kind of it's meant to be kind of in an age range of I think they targeted maybe like 18 to 49 and so it's not conditionality, but it's targeted. I would say it that way. In terms of, you know, if you go back to that paper in Science where they did it across 6 different countries, each country did have flexibility to kind of tailor certain aspects of the program to that environment. So I think where you see that most is in the initial asset transfer, that lump sum transfer that happens right at the beginning. In some places, it was specifically a certain type of livestock. So it might have been something that was kind of locally appropriate as kind of a, you know, a business, a livestock that could be turned into some kind of business. In other countries, and I think this has moved a little bit more towards just giving cash and allowing the beneficiary to kind of decide exactly where to put that, where to invest it. So I will say it's not conditionality, but there has been tinkering around whether it should be more in-kind transfers, which are a little bit more, I would say, paternalistic in a sense of kind of forcing. I mean, obviously the person could always go sell that livestock, but why make them do that? Why not just give cash? So I think that where this has kind of moved is towards just a cash-based program, and to kind of remove those, you know, a little bit more of that paternalistic, forcing households to kind of adopt a certain livelihood that where maybe they would be better served doing something else. Yeah.
Thank you so much.
Okay.
Our second presenters, people over there can hear it, but they'll see is Dolores and Pam.
Thank you very much, Dolores, for coming with your, you know.
Yeah, we are.
Great.
I know, everybody's.
Yeah, you don't wanna hang out with us. Yeah.
If you have told us, you know, I had an accident.
Just let me make sure that I can support my arm somewhere here. Yeah. So I wanna have my arm here. Yeah, that's good. And then I can just move with this, right?
Yeah, to the
Oh.
side. Yeah, with that, you can just click here to the.
Yeah. And, oh, that's just people that have online. That's
Yeah.
fine. So let me probably. No, I don't need my glasses. I can look at this.
Right.
Yeah, that's good. Thank you.
Okay, perfect.
Okay, so actually, when we submitted this abstract to present here today, we didn't know that we're actually gonna get this small grant from the WT Grant Foundation to work with Stephanie. And our colleagues from Columbia, the center. Yeah, we have converged. We've been converging since we joined BU in January, so that's really good.
The camera's on.
Oh,
Sorry for interrupting.
You hit escape, sometimes that little, that little bar.
I'm not sure where it's. Let me,
but if they can see the slides, probably.
yeah,
Let's do that.
let's just do that.
Yeah.
We just want to see them.
Yeah, the owl is off. Maybe I
But
got
can you see them
Oh,
now?
the owl got off?
Yeah, owl,
Yeah, they,
something, not lighting up.
oh,
I'm not.
but we can keep going. They can see you here now, sorry.
Oh, okay. Okay, so I'm just gonna repeat what I said because I'm not sure they heard.
Push the button.
So when Pam and I submitted this abstract to present here today, we didn't know that we're gonna actually be getting this small grant from the WT Grant Foundation to be working with Stephanie and her team, and also colleagues from Columbia University, the Center for Poverty and Social Policy. So our presentation is very different. We are actually not gonna talk much about this project, but we wanna tell you a story, the work that we've been doing on this question of including children in immigrant families in the US safety net, social and health safety net over a few years now. And obviously, we're also trying to find more points of connection with people at BU, and we are doing an event with Dina and Ruth in a few months. So I'll talk more about that in a moment. Cool. Sorry. Oh,
Let's see.
this one?
Yeah,
Oh, okay.
now you can do it.
Okay, great. Yeah. Okay, so that's just our team. We are at the Institute for Equity in Child Opportunity and Healthy Development here at BU at the School of Social Work. And so we've been doing a lot of work on children in immigrant families. I'm sure most of you are familiar with this very important fact that 1 in 4 US children today are growing up in an immigrant family. So that means at least one of their parents was born outside of the United States. And that includes a number of different immigration statuses, socioeconomic statuses. It's obviously a very diverse population, but it's a huge proportion of the child population in the US. We are particularly concerned about the kids that have more challenges growing up. So that's why I wanted to also mention this statistic that about 42% of children in poverty in the US today are children in immigrant families. So when we design anti-poverty policy in the US, obviously we have to pay a lot of attention to these families and how they are eligible or not for the programs that we have to help them, how they can access the programs, if they know how to access the programs, etc. And so I've been doing work on immigrants for many, many years. One thing I wanted to say is that actually, when I first got interested in immigration, it was because of all the really positive aspects about immigration and immigrants, right? People moving from one country to another. That's obviously, involves a lot of entrepreneurship and taking risks. And actually, immigrants tend to be extremely positively selected among people in the country, and they have a lot of resilience health-wise and otherwise. So what you hear today about immigrants is completely the opposite, right? So we are trying to promote this course about immigrants and children in immigrant families that is more driven by data, by actual facts and what we know about them, instead of all these ideas that are floating around. So this is a picture. I'm not going to try to explain it all, but we've been working a lot on what are all the different types of challenges that children in immigrant families are facing that are unique to their experience as children that live with people that have limited access to a lot of things, sometimes more limited human capital, sometimes more limited access to health and social services, a lot of discrimination in society, a lot of xenophobia, a lot of things are going on. A very important part of that is legal status, right? And it's funny because even 2-3 years ago, only very like people trained in sociology and particularly in the sociology of immigration would be able to talk about this question of legality as a dimension of social marginalization, really, and also liminality, which essentially is that it doesn't really matter strictly if you are undocumented or you are a citizen. There are a lot of statuses in between, and many of them are subject to a lot of vulnerability and risks, even if people are not undocumented per se. So this used to be like a super complicated thing. I've been doing this work for many decades. At this time is decades. No, but we got a big push to focus on this because of my participation in a National Academy of Sciences a committee and then report on a roadmap to reducing child poverty that was released in 2019. So there were a lot of simulations of what different anti-poverty policies could do. And we really wanted to kind of take the report and highlight, particularly for children of immigrants, all the ways that they were being excluded and the effects that the exclusions could have on them. And the flip side of that is how could we improve policy to include these families so that they could enjoy the benefits of our safety nets. So we started doing that. Pam, an approach that she has developed, policy equity analysis, we applied that to looking at some of the programs, the earned income tax credit, the child tax credit, SNAP. So we've been doing that for a while, and we partnered with Unidos US to do some of this work and try to take it to a broader audience. We just finished literally, I think 2 weeks ago, we released this new report, another National Academy of Sciences committee looking at the effects of federal policy on reducing child poverty, particularly the tax credits, the EITC and the CTC, and the statement of task as the committee to look at differences by race, ethnicity, nativity, so immigrant status, as well as citizenship and immigration status. So we are just right now preparing to kind of do what we did with the previous report, which is our team takes data, a huge amount of data, and try to process it in a way that is gonna produce an equity analysis, which is not part of the report per se. And even more than before, obviously, we have a very strong incentive to focus on children in immigrant families because what we've seen in the last few months is even more restrictions. So that's where we are at right now. The EITC in particular, but other programs that we have, they actually have very strong causal evidence that they have a lot of really positive impacts on kids. Reducing poverty is an obvious one, but also effects on education, both attainment and performance, health, and even interactions with the child welfare system, the range of benefits that have been shown in quasi-experimental design. So we have a lot of really great evidence. So again, this is a slide, and I'm not going to explain that it's part of a report that we did when we were working with Unidos, trying to digest the first report from the National Academies and doing additional simulations. So we asked a very simple question, which was, let's not do anything to the earned income tax credit. Leave the program as generous as it is now. We are not going to tweak anything. The only thing we're going to do is make children are not able to get the EITC now, and those are citizen children. Even if one of the parents doesn't have a social security number, they forgo that benefit completely. And it's one of the most generous benefits that we have in our tax system for low-income families or relatively low-income families with children. So they completely forgo that, being citizens of the US. So what we saw is that if we included the children without doing anything else, we would have relatively small reduction in the overall poverty rate, but a very, very significant reduction for this particular group of kids, citizen children living with undocumented parents. Reduction of about 30%, which is enormous, especially if you consider that these kids start with one of the highest poverty rates at baseline of more than 30%. So we are gonna start processing the report, the new report, the appendices in this way to show some of these impacts more clearly. So right now we are very, very happy, and another thing that we share with Stephanie, that we are part of an effort that is being led by the Foundation for Child Development to create a network. And the name of the network is what I mentioned in the beginning, 1 in 4. So 1 in 4 US children are children in immigrant families. So for this network, they're trying to make researchers partnered with advocacy groups and with other researchers so that we can have a concerted effort and evidence that we align and towards the same objectives of improving access and reducing harm, especially during this period. Beyond that, we also want to create a positive vision for children in immigrant families going forward. And we also need to be proactive. And I think everyone that is part of this network agrees on those principles. Like, yes, we need to defend, but also we need to be proactive and look forward. So right now we have a pending grant to start building the piece of this effort that would be ours housed here at School of Social Work, which is essentially a data collaboration with Columbia Center on Poverty and Social Policy, and also ITEP, the Institute on Taxation and Economic Policy. And what we are doing is we're going to build a data system to provide indicators of well-being for children in immigrant families, indicators that we have been producing over time, or they've been producing over time, like poverty, simulating also effects of policy changes, indicators that PAM has developed over time, like access to paid family and medical leave, affordability of paid family and medical leave, the same for childcare, etc. So we are waiting to hear about this grant, and it would be like a data piece of this network that is much bigger than just our project. We are also working with the foundation and the coordinating hub that is housed at NYU. Stephanie knows and talks with the foundation very often. No, it's a huge effort. Many of the advocacy groups are trying to protect immigrants are part of the network. So it's a very, very exciting effort. And PAM has another grant that is actually a follow-up to our first collaboration with UNIDOS that is very exciting and is funded by Work Rights at the Urban Institute. So this grant is looking at states that have decided to have a paid family and medical leave system, which of course is very important because we don't have one at the federal level. And states actually in many instances are trying to include immigrants, but it's very difficult to do for a lot of reasons, from eligibility, because they tend to use the unemployment insurance system as a vehicle to assign those benefits, paid family and medical leave benefits. And that system, by definition, is not accessible to immigrants because they don't have eligibility for it. And this is a grant that we just heard about. Like, no, we don't have the funds here, but they will come soon with Stephanie and with Columbia. So what we are doing is these grants feed evidence and data to people that can help with some kind of policy change that is going to promote child well-being. In this case, it's going to be improving the inclusiveness of children in immigrant families, and the Massachusetts EITC and the Child Family and Tax Credit, which is our state CTC. So we are going to be giving Stephanie and her group a lot of evidence reviews, as well as data that we are going to produce in collaboration with Columbia. And they are going to work through networks that they already are part of, and they've been very active in this advocacy work in the state already, including being instrumental in the passing of the Child Family and Tax Credit earlier. So we are very excited about these. And WT Grant has these rapid response grants that allow us to work with UNIDOS a few years ago. So we are using all these mechanisms that see researchers as needing to be connected to action, to advocacy, to policy change. And and we've been converging here at BU as well. So that's very exciting. Yeah, another aspect of convergence is that we are going to do an event with Dina and Ruth. We are scheduled for February, I think February 26th here at BU. And it's going to be showcasing the research at BU through the university, different schools, departments, people that are working on children in immigrant families, research connected to advocacy, all kinds of work. So we're very excited about that. We were asked by the provost office to do a Research on Tap event. And I was delighted when I heard that they had identified this question of children in immigrant families as something they wanted to focus on. So we feel like really good about this event. So I think I'm probably out of time, so I'm gonna go to the questions. So, well, obviously, this is a very different type of presentation from the first one we heard. This is not about specific project. It's about kind of a body of research, a way of engaging with advocates and policy change that we have been doing for a while in different areas of our work. So what we want to know is, of course, who else at BU is working on this topic in particular, or has this kind of experience of connecting to policy change. And particularly if you have connections in Massachusetts, we'd love to hear about them. So I'm going to turn that to Stephanie.
We have
Oh.
probably a couple of minutes if there are questions.
It is all very exciting
Really.
to hear. And so I think I have a question, or perhaps I'm thinking about, as I was hearing, of course, all of the work that you are sharing and doing relates very closely with what we do at the Institute for Early Childhood Wellbeing. So that's my first kind of reaction, right? So there's a natural collaboration that should exist among, the two institutes, definitely. And the other piece is related more to, the work with immigrants. So at the Institute for Early Childhood, we also have work with immigrant families. And some of us are working on the perspective, not necessarily only in the US, but also globally. So that's another, so this is an issue that is affecting, immigrant populations across, around the world are being affected by these xenophobic reactions for these different, conservative, movements around the world. So that's happening everywhere. And that's something that perhaps we should, we could discuss.
Yeah.
further In terms of that, what in our institute, we are doing a lot of that, contributing that perspective to this. The work, people are moving, but it's happening also in I'll stop there, but definitely we do have contacts with the community organizations, the Office of Early Childhood, and in the city of Boston, and also in Massachusetts, the state of Massachusetts, the commissioner had been invited, the commissioner and Early Childhood have been invited to our events several times. They always welcome the opportunity to come to the discussions that we organize and bring the community together to discuss, to talk about the different aspects related to the work of young children in Massachusetts. So I will be happy to share those comments.
Yeah.
Allison Bachman in the chat mentioned that she has been working in this area of children and youth with special health needs and disabilities, and would very much like to connect. I can give you her contact information later.
Thank you. Thank you. One of the things that we want to do as part of the Research on Tap symposium that we are doing with you guys in a few months, and actually our comms director, Leah, already started doing a directory of people at BU working on children in immigrant families or immigration more generally. So we want to list who they are, of course, their school, the topic, whether they have funding for the work or they've had in the past publications, etc. So I think that we have a draft that is pretty good, and we actually want to circulate that to a small group
We also have been trying to put together.
so that we can add people and make sure that it's complete. So we are going to be doing a little bit of snowballing so that we can make sure that everyone is there.
To your questions, Dolores, I think one thing to also make sure, given that we have this Research on Tap coming up, to remember to invite all these community groups as well.
Yeah.
Because
Yeah.
that's the chance. for
Yes.
folks to
Yeah.
get on the ground doing the work.
Yeah.
That's
Yes.
always been
Yeah.
on the list of.
Yeah.
Yeah.
And that would then build the bridges, because I do, very clinical research, right, in a
Mm.
much more sort of smaller
Yeah.
community-based work, and I look at your work and I'm like,
Yeah.
oh, that's fabulous, it's all big, and I'm like thinking, how do we?
Yeah, actually, when I, I think this was before I joined BU, but just a few months, you guys had that wonderful symposium where
Yes.
that lady from California that spoke about, and you had actually this doctor at the BMC that we also have in our director, because I saw her then,
Yeah.
yeah,
It was Gabby, no.
Rosa.
Oh, Carmen
Oh,
Rosa.
Carmen Rosa. No,
Yeah.
yeah.
So anyway, that was a fantastic seminar, and for me, it was very, very educational, because that way of talking about these impacts, in terms of the concrete, ways in which the family and the child suffer from this, and the trajectory, the developmental trajectory of the child is affected because of all this fear about separation and all these things that the family has to negotiate, even when they reunite, right? They have to keep dealing with that for years. And I think that being able to make those connections, especially when we talk to people to try to appeal to them to make some changes in the state, gonna be super important. So I was planning to share the Blair for that soon with you guys, and we will next week. So we've done a lot of work, and I'm sure you guys have too. So I think that should be a really good event.
Yes, a
Yeah.
great opportunity, and it's very timely.
Yeah,
The topic, of course, so I think that's, if we can make a contribution in these current times, from our position in the academia.
Yeah.
To give visibility to what is happening with young children. and
Yeah.
immigrants, I think we should
Yeah.
do that.
yeah. Having said that, I think it's also important what Pam and I were just kind of exchanging, just looks before we started talking. And we are facing this in every meeting that we have. There is some kind of line between, yes, we want to be active. At the same time, we don't want to say too much about what we are doing. I was actually trying to find the 1 in 4, and the Foundation for Child Development doesn't have anything on the 1 in 4 yet.
Yes, it is.
And Stephanie, want to talk from there?
We can move this computer.
Rolling my way.
Right.
These happen after the initiation.
You should be able to just click here.
Okay, great.
But thank you.
Um,
But you can have skilled yourself or doing our own, but Zoom.
Which, did you say the arrow buttons? Is that what I should use? The arrow buttons?
Writer.
Yeah, okay, great. Well, excited to be here, and lots of ideas popping from all these discussions, but I'm going to talk about something related but different, and actually to your point about childcare, looking at what we've called childcare constraints and health and material hardships among families with young children. Oh, well, that's weird. Didn't look like that on my screen. Anyway, that's supposed to be an arrow from the scales downward. I don't know what happened. Anyway, so this is all stuff that, anybody that's in the early childhood world knows, that high quality nurturing and affordable early education and care have demonstrated relationships and, positive relationships with school readiness, cognitive development, social and emotional skills, and that in turn leads to better educational, social, and career success as in adulthood. But childcare is also very vital to workforce participation, and we know lots of research again on stable, reliable childcare, and its importance again for workforce participation, but also to reducing barriers to work and education specifically, and then in turn leading to better economic mobility and national economic growth. And this is, I think, just a nice visual from the pandemic. And I think the pandemic, so for anybody who's been doing early childhood work, like, we knew forever childcare was really important to the workforce and to the economy, but it was like the whole world woke up to that during the pandemic, like, oh, this is really important, and it underpins every, adult with a child's ability to be at work. And so this is from Pew Research looking at across all, this is all incomes with people with children younger than 12, and looking at March and October of 2020, and the how difficult they said it was to actually be
working and handling childcare. So also, I think a newer thing was men waking up to that fact, right? More widespread. I mean, obviously, some men got that, but a more widespread understanding that this was really fundamental to their ability to be at work. So this is actually 2023 data. I need to update this with 2024 data, but this is from Childcare Aware, looking at the national average of childcare. I think in Massachusetts, we would all be like jumping for joy if we paid $11,000 a year, but this is the national average. But costs have really, really increased. And then in Massachusetts, there are, way higher. This is for one toddler and one infant. That would be average cost of $47,000 a year. So that's just, I mean, it's a gigantic amount of money. And the little pop-up blocks it, but we are one of the highest states in the country as far as costs for childcare go. So it's a real problem. And some of the barriers, and they're very much interrelated, are cost, as we just saw, location, is it close to my work? Is it close to home? Is it on the way to somewhere? Do I have to go out of my way to go there? The hours, if people are working non-standard hours, second shift or something like that, weekend hours, it's really hard to find regular childcare. Availability is another thing. So even if you can get over the cost and the location, maybe there's no spot left. And then cultural competency is another big issue, like, am I sending my child to a daycare where they're not, or a childcare that they're not going to honor my cultural background? They're not going to, some of the research we did, families talking about how their, young Black child went to a childcare that only had dolls with blonde hair, and so then they, sort of like this disconnect for them. So that, that, or not speaking a language or whatever it is. So all these things, and that's not a new idea either. But then in all of these barriers, then there's also the issue of quality. So maybe you get over all of these barriers, but then what's the quality of the childcare like? So all of these things together restrict parents' ability to pursue work training or education, and that's really sort of our lens on this, and coming at it thinking about the childcare constraints, which I'll talk about more in a moment. Childcare subsidy, and Pam knows way more about this than I do. But there's the sort of the big two funding mechanisms for childcare subsidies. There's federal guidelines around it. It has an eligibility cap at 85% of state median income, but states have a lot of flexibility in designing and implementing, or not a lot, some flexibility in designing and implementing childcare programs and policies. And there's lots of great positive research on childcare subsidies. It increases caregiver employment with relationship to employment is what I'm talking about. Longer periods of maintaining work, parents reporting that they are able to access higher quality care because of the subsidy, and also especially so in states that have more generous rates, of more generous reimbursement rates for subsidy. But there's a whole host of other challenges, right? There's states have these choices. There's limited availability. There's not enough money to go around for all the people who are eligible. They're lengthy wait lists, sometimes mismanaged wait lists, can be overly restrictive eligibility criteria. Applications can be difficult, redetermination could be, the timing can be difficult. Somebody not being able to get a childcare subsidy until they've gotten a job, but they need the job to do the interview to get this, so like the sort of chicken and egg issue. Restrictions in who can be eligible to be a childcare provider versus subsidy, supply limitations, and then some of these things I've already mentioned, other barriers being like, what if you live in a rural area and there's a transportation desert, kids with disabilities or special needs, and again, some of the other things that I mentioned around English proficiency and cultural competency and all that. So again, our lens on this is thinking about the economic aspects and how that intersects with health. So that's what's the health impact of struggling with childcare access, or the sort of, oh, that's so funny. That's so interesting, because on my screen, so apologies for all the weirdness with this was much bigger. Anyway, whatever, doesn't matter. Okay, it's somehow over the computer, it translated into something different. What is the relationship of childcare constraints with child health and development, caregiver well-being, and household economic well-being? So sorry for those of you who know about Children's Health Watch. This is a repeat for you, but just to sort of give you a primer on our data. We're a research and policy network that was founded in 1998 in the wake of welfare reform, been around for 27 years. We're headquartered at Boston Medical Center. We have research sites here in Boston at Boston Medical Center, and then also in Arkansas, Minneapolis, and Pennsylvania. And we're really focused on achieving health equity for young children and their families by advancing research to transform policy. So very deliberately sitting at that intersection of research and policy, being focused for a long time on economic hardships and public policies and the ways that they impact infants and toddlers, and really thinking about kind of to your point, Dolores, like the driving forward towards an equitable society that prioritizes their health and economic well-being. So this is our network. We're in, like I said, healthcare locations, hospitals across the US. We have a former site in Baltimore. So the data I'm presenting actually includes the Baltimore data, which is why I'm saying that. This is our data. And the data that I'm going to talk about today comes from this yellow box, but I figured it'd be an opportunity to sort of explain our data more broadly. We have a survey. It's a repeat cross-sectional survey. We're interviewing caregivers who are bringing their young children in for care in pediatric emergency departments and primary care clinics in 5 US cities. They're all children under the age of 4. And it's a survey that covers a lot of ground, from some health outcomes and a variety of economic hardships, parent health, program participation, stuff about immigrant families. So quite a variety, and also a section around early education. We also, over time, have built up an electronic health record repository where we have linked data. We're able to access the children's health records and we're able to follow kids longitudinally over time through their health records. That has also provided us the opportunity to geocode that data, because we have addresses, and we've been able to link with census data, environmental exposures, and a whole host of other things as well. Just briefly, in the pandemic, we realized we had to stop our regular data collection, and realized nobody really had their eye on young kids in that moment. And so we launched this spit and chewing gum longitudinal follow-up study. We did 2 waves of it. We are trying very hard to fundraise for a 3rd wave, because we want to follow the families out. We're able to, collect a lot of timely data on families that we had spoken to pre-pandemic and follow up during the pandemic. And then lastly, we've also used this as a launching pad for several qualitative studies. Just one example is a child tax credit study, where we did focus groups and semi-structured interviews following up with families that we had talked to in the sort of Children's Health Watch study. So that's given us, this rich survey data, and then also qualitative data to match it with. So that's just sort of like the world of Children's Health Watch data. But getting back to childcare, this is the question that the study that I'm presenting today is built off of. So do problems getting childcare or with childcare hours make it difficult for you to work or study? There's a yes, no. And then if they say yes, then we ask a series of, they offer a series of options about what it actually meant for them. And I will say, this is from our survey pre-pandemic, and then our post-pandemic survey has an additional question that then gets into the why. Why are you having trouble with your childcare? So as far as what I'm going to present here, this is cross-sectionally, this is from 10 years. This is through 2019, about 31,000 families. Caregivers provide a whole lot of demographic data. And here we have for the child their early education and care setting, whether or not they receive a child care subsidy, obviously the child care constraints question, and then age, sex, anthropometric, I don't know where that went, parameters and things like that. For this study, because we felt like this kind of requires its own investigation, we actually excluded kids with supplemental security income, anyone who had passed early special education and intervention, and then nursing care, because we want to do like a separate analysis to focus on that and the sort of the specific challenges that those families are facing. And as far as health outcomes, we looked at child health status, developmental risk using the parents' evaluation of developmental status, lifetime hospitalizations, admission from the emergency department, parents' health. This is mostly mothers, like more than 90% are mothers, but caregivers' health, and then maternal depressive symptoms. On the household hardship side, we looked at food insecurity, both household level food insecurity and child food insecurity. I imagine everybody is familiar with that, but inadequate access to enough food. And then the child level is much more serious. It's when there's real scarcity in the household. Energy insecurity, which is families struggling to afford the utilities that they need to heat and cool and light their homes. And then housing stability or housing instability. This, like whether families were behind on rent, moved twice or more in the past year, or experienced homelessness. So in this sample, most caregivers did not experience childcare constraints. More than 70% did not have childcare constraints. And the groups were quite different. Those with childcare constraints were many more of them were US born, more white, married and partnered, had at least one person who was employed. About a third had a childcare subsidy versus just under a quarter in the childcare constraints group. More of them used childcare centers. So you have 27% using childcare centers versus the childcare constraints group, just 16%. And fewer of them stayed at home. So just under half stayed at home with the child. And then on the childcare constraint side, more parents were part-time workers versus full-time. More of them were stay-at-home parents. There were more Latina mothers in that group. And it was interesting, there was no difference in proportion of Black mothers across the childcare constraints and no childcare constraints groups. There were more immigrant mothers also in the childcare constraints group. And interestingly, there was, they were twice as likely, is what I'm trying to say, to be on the subsidy wait list if they were in the childcare constraints group versus actually have a subsidy. And there was no difference in child age between the groups. So the samples there's two analyses I'm going to present. One, the childcare constraints analysis was because of the exclusions, ended up being just under 23,000, adjusted for a variety of demographic and other variables there. And the childcare subsidy group, we excluded stay-at-home parents, and I'll come back to that for this analysis, and just looked at people who had some form of childcare outside the home, and that was about 15,000 families. So I have a summary slide. You don't have to look at this, and I'm sorry that was all covering itself up because it wasn't like that. But basically the takeaway is all compared to those who had childcare constraints, those who did not have childcare constraints were less likely to have basically every outcome except hospitalizations, which is sort of an interesting one. There was no difference. This is the summary. Essentially childcare constraints, those with no childcare constraints had significantly lower odds of very poor child health, developmental risk, being admitted from the emergency department. So on the day they came in through the interview, if they were in the emergency department, they were sick enough to have to be admitted to the hospital. The caregivers were more likely to be reporting depressive symptoms and reporting very poor health. And then all of these hardships are independently connected with poor health and healthcare utilization outcomes. So families were less likely to have all of the various hardships. So yeah, I mean, in summary, we're seeing that childcare constraints, not having them is, a support to health and families' ability to afford what they need. And conversely, childcare constraints puts children and their parents at risk for poor health and greater economic hardship. So then we did look at subsidy as well. And this is comparing those who had a subsidy and those who didn't, and whether or not they had childcare constraints. So those who had a subsidy were much less likely to have childcare constraints than those who did not. And so what does this all mean? So I think the sort of biggest picture, it underscores the role of childcare and expands our understanding of the intergenerational impact of childcare and its relationship to family economic stability, and one could then extrapolate mobility. But I think that mothers and parents, especially of very young children, tend to be sort of out of the public eye and out of the sort of prioritization. So this kind of childcare came up and people understood it during the pandemic, and it's sort of like fallen off the radar somewhat. So what's next? We're actually in the midst of updating this whole analysis, flipping the comparison to make it a little more intuitive, focusing on the childcare constraints, and making the reference group the no childcare constraints, adding the stay-at-home parents back to the childcare subsidy analysis. In some of the conversations we've had, you know, thinking about, well, those people are at home maybe because they don't have a childcare subsidy, right? So like they should be in that analysis. And then we now have data up through 2024. So we're going to bring up the time period as well. So yeah, I'm interested in anybody's feedback on any of this. And I want to thank my partners in this work. They've been in the weeds of this with me, and my team at Children's Health Watch. So thanks.
Can you say more about the constraints? So there are different types, right? So these
Yes.
look more close into.
Yes, I
some of
didn't
the
put that on
examples.
here, but yes, so most people report work or education alone. And the group reporting both things is smaller. So the majority, I don't remember the percents off the top of my head, but the majority are reporting that they aren't able to work as much as they'd like to because of childcare constraints. And then a smaller group saying education is the thing that they're really struggling with. Yeah. Yeah.
First of all, thank you. This work is, you know, just affirming, it brings back nightmares when kids are older, you know, real hard childcare nightmares.
Yeah, yeah, it's real.
It is such the biggest stressor of, you know,
100%.
so, I'm like, that was a mistake.
Yeah, somebody in the chat, Allison Bogman mentioned that she is very interested in what this looks like for families raising children with chronic conditions and disabilities. They work with many parents that have stopped working because of their child's conditions or forego work promotions.
Yeah, I think that's a really important point. And we debated, should we leave those kids in, should we keep them out? And then decided they need their own attention. So I'd love to follow up on that. We've done a couple of studies now looking at children with special healthcare needs, and housing stability, and then also food insecurity. And anybody, you know, I'm sure you know, those families are much more at risk for housing instability and food insecurity. And then we looked at even amongst them a subset of kids that were receiving SSI, and you know, they're you know, very much at risk as well, although they were less likely to be housing unstable. And I think that is a credit to the support that kids on SSI get, right? But not every child with special healthcare needs gets that. So yeah, great point.
Yeah.
Oh, there are a bunch of comments. I don't know. Do you want me to pull them up?
Yeah, well, pay attention to that. I have another point, but.
Okay.
No, she just
Yeah, we
mentioned
want
that the intersectionalities are very interesting. That's it.
Okay, all right. Was that,
Yeah.
okay, thanks.
Yes, okay, well, I already have a slide that,
Oh, okay, great. Let's do it.
well, actually, I have data from a old study that, we conducted interviews with the Latina families
Mm,
about their childcare needs.
Mhm.
So they were staying at home, right? So we had these groups of parents, those that stay at home, but another group. It was more like a qualitative. It was a qualitative study, but we conducted like about 400 interviews qualitatively. That was, you know, hard to analyze, but I have the you know, the database. And it would be interesting to, thinking and comparing with the results that we have now.
Yeah.
And try to perhaps the secondary analysis.
Yeah,
Data set. So, but I'll talk to you about that, because definitely have been interested about a decade ago, so it's, the changes, a lot of stuff has happened.
Yeah.
With the families and the kitchen, but it will be interesting to see if there are changes.
yeah,
Or there's things that stay the same. The
Right.
Challenges persist, that's the other piece to
right,
highlight, right?
yeah,
If the persist. So that was my comment. And the other was related to analysis, again, by, race and ethnicity. It's highlighting the differences because the challenges may be different for
Yeah.
certain groups depending on your ethnicity, your race, your gender.
agreed. Yeah. And I think the nativity piece too, I think that would be
Yeah.
really interesting as well to look at the immigrant families, like. We know in general that the immigrant families in our data set anyway tend to, be more stay-at-home parents, and the caregiver, usually the mother, is the one staying at home, and then there's somebody else working in the household. That much we can see. But I thought this, given that we already knew that about the families in our data set, I thought it was interesting to see here that there were more Latina mothers and more immigrant mothers in the childcare constraints group. So like maybe they're staying at home, but that's not what they want to be doing.
Exactly.
So,
I think that's more or less something that we
Yeah.
found also,
Yeah.
because we wanted to address if it was a myth or not, the fact that the people in the childcare, services, area profession, there's the agencies saying, oh no, the Latinos, they don't like, because it's a cultural thing.
right,
They prefer to stay at home.
right.
But we wanted to know if that was.
Is that true? Yeah, right. Yeah, right, exactly. Yeah, yeah,
I know we're out of time, but, I think it's interesting on the childcare constraints and the material hardship, that association, I understand. So I spent a lot of time in the subsidy system, way too much.
yeah. Tell me, what have I gotten wrong?
Well, no, I'm not sure I understand the logic, because in order to get a subsidy, you have to be working. And so I was just trying to figure out the logic of, there's also a whole line of research that finds that subsidies have either null or negative impacts on health. And one of the reasons, the hypothesis is what you were talking about in terms of employment, right? So if you have childcare, but you go to a bad job, then your outcomes aren't great. And it
Exactly.
also depends on your childcare subsidy and
Mhm.
environment. So that one, the subsidy part I'm confused about, like,
Mhm.
trying to figure out, like, the subsidy definitely reduces childcare constraints, right?
Right.
Because now you can afford it more.
Yeah,
So I'm like trying to figure out the ordering of it, right? Because you've got a subsidy that reduces constraints, and then, like, are you modeling it that way, right? Where it's like subsidy reduces constraint, comes to better outcome, right?
yeah, we didn't do the health outcomes per se, would more sort of like demonstrating it's a fair point. And I'd love to talk more about it with you, but we decided to go with what does childcare constraints mean for health and family hardship broadly,
Yeah.
and then looking at childcare subsidy separately, like, does it make a difference? Does it reduce childcare constraints? But I hear what you're saying. Yeah,
I mean, the material hardship makes a lot of sense.
Yeah.
Just the health part, I think, is challenging to understand the relationship.
of the childcare constraints, you find that hard to understand? Or are you saying the subsidy
Just to
piece of
figure out
that?
The subsidy childcare restraints is just like what, because getting a subsidy will put you potentially in a job, and but you're also controlling for employment. So I guess I'm having a hard time understanding the logic of the model.
Okay, all right.
If that makes sense.
Not entirely, but I would love to talk to you about it more. I mean, that's a fair point about controlling for employment, so that is an interesting thought. Maybe we shouldn't be.
Right, so there's some ordering, I think
Mhm.
we just have to think about,
Yeah.
especially since it's project,
Yeah,
right? So
Yeah.
then it's like, then you've got that problem, right? Of
Yeah.
just having the cross section. So I think I'd almost have like a smaller number of it, like,
it's very descriptive, right? So it's almost like maybe painting more of a descriptive picture and then hypothesizing maybe about the pathways or.
So are you concerned about the connection between childcare constraints and health? Is that what you're saying? Or the subsidy?
It's the subsidy.
Yeah.
That I gave.
Well, we weren't modeling it with health,
You didn't
though.
include
It was
subsidy.
just the childcare constraints that was just childcare subsidy and childcare constraints was all it was.
But you received a subsidy.
In that one was people who did and did not receive subsidy. The second analysis was for those who received a subsidy compared to those who didn't receive a subsidy, were they more or less likely to have a childcare constraint? Sorry, we're using up time. No, it's fine, it's good. But I would love to talk about, way more about all this than I do, so I'd love to chat.
Thank you,
Yeah.
all the presenters today were wonderful, and we hope you'll come back and share like what happened next.
Yeah.
What do you do with this stuff? And I wanted to remind all of you that you may, hopefully got an email about our university community partnership. Grants, please think of people who might want to remember 2 different BU faculty members and a community partner.
It has to be a Massachusetts-based partner, so.
No, it could be global, national, all other states.
Yeah.
We have funded actually, grants and, I think we have one in Louisiana right now and one in South Africa. Yeah.
Yes.
Hello, everybody, and goodbye. Thank you very much for coming. Bye.
Gracias. Muchas gracias a todos. Thank you.
We are inviting everyone to our annual keynote. It's going to be in November 6th. Please mark your calendars. We hope you can attend. Thank you.
Yes. Did you hear, did you get